So moving on to viruses. So I'm going to start off with chapter 24, which is all about the viruses that contain DNA as the nucleic acid. And then we will transition into chapter 25, which is all about the RNA viruses. So just some basics as far as the characteristics of all viruses. Remember that every virus has either DNA or RNA, and that nucleic acid is surrounded by a protein coat called a capsid. All viruses are obligate intracellular parasites, so they require a host cell for replication. And I like to refer to them as hijackers of the host cell. So they actually will exploit some of the host cell's molecular machinery to produce and release new viral particles. Now, a couple of trends here with DNA viruses. The majority of DNA viruses are DS or double-stranded. The one exception are the parvoviruses. RNA viruses are mostly SS or single-stranded, except for the reoviruses. Also, all viruses are limited to a particular host or cell type. So, for example, influenza A versus influenza B has different hosts, so it can infect many species or just solely human. And within that host, that virus targets the respiratory tract or cells of the respiratory system. So every virus, again, has a particular host and also a unique cell type within that host. Most DNA viruses will bud off from the nucleus, so this would be after they have undergone transcription and translation to make all of the components of that virus, whereas the RNA viruses only need to replicate in the cytoplasm. So RNA replicase will make new copies of it, and then the ribosomes are hanging around to make all of the protein. Now, as you'll see from this lecture for DNA viruses, we're going to see this wide range of infections associated with a DNA virus that are asymptomatic to mild infections to also fatal. So we'll see that with the RNA viruses as well. And many of them are strictly human in origin. Others are the causative agents of zoonotic diseases. And so for those, again, this is involving animals and they're transmitted via insect vectors. Now, some of the common symptoms of a viral infection would be a rash, a fever, muscle aches, respiratory involvement, swollen lymph nodes. And the immune system will respond by the action of interferon, also antibodies, and the CD8 T, cytotoxic T cells, are the immune system cells that can destroy virus. So there's actually a population that has a high amount of these cells that is indeed resistant to HIV because it'll just wipe out that virus. Now, as far as the course of viral disease, they all have their own portal of entry and associated primary infection. Some of these viruses will replicate locally, others can spread and infect other tissues. Now, some viruses have an acute course of an infection, very rapid course involving the lytic cycle, while others are associated with long-term persistent infections, and these can last many years up to a lifetime. And there's two different types of persistent infections, chronic and latent. So in the case of a chronic infection, the virus is detectable in tissue samples and it multiplies at a very slow rate. The symptoms are mild or absent. So an example of this would be hepatitis virus versus latent infections where after the lytic cycle, the virus enters this dormant phase, and at this point it's generally not detectable. There's no symptoms, but it can be later reactivated and result in recurrent infections. So an example of this would be some of the herpes viruses. Some viruses are also associated with cancer. So in the case where you have a cancer predisposing virus, we call this an oncogenic virus. Some, like the causative agent of German measles, also can induce birth defects, which are permanent defects, and this would be referred to as a teratogen or teratogenic. Now, as far as diagnosing viral infections, we look for the symptoms, we look at the cytopathic effects, so that would be the effects on the cells that are infected, also serological tests to screen for antibodies and antigens. And so the pictures you see in the bottom here are related to this first statement that some persistent viruses are oncogenic. And this picture on the bottom here, these are the two early microbiologists that discovered evidence to suggest that viruses cause cancer. And the first one discovered was in chickens. It was referred to as the Roux sarcoma virus. And so the mechanisms behind this, it's thought to be via the activity of tumor suppressor genes and oncogenes. So in the case of a cancer cell, you have oncogenes that are constantly turned on. So the analogy that I give here is for the example with a car. So you can think of a cancer cell as always having the gas to the floor, so the gas pedal is always pushed all the way to the max, whereas the brakes are not working. So this is why cells that are cancerous are immortal. If you guys have heard of The Immortal Life of Henrietta Lacks, that is referring to an African-American woman in the 50s who died of cancer, and her cells, the HeLa cell line, is still being circulated throughout labs all across the world. Her particular cells are still replicating in vitro in culture, and it's because of the fact that the oncogenes, like these mentioned here, are turned on, and the tumor suppressor genes are turned off. So RB1 and P53 act as tumor suppressor genes, and this allows for the perfect recipe for disaster to predispose a cell to becoming cancerous. So all of these are associated with oncogenic viruses: human papillomavirus, Epstein-Barr, Kaposi sarcoma, hepatitis C. They all activate the oncogenes, and also these viral proteins will inhibit the tumor suppressor genes. So that will encourage cells to transform into the cancerous state. Now, as far as all of the DNA families of viruses that I will mention here, there's 7. There's 15 RNA families for chapter 25, and basically the book kind of breaks them up into whether they're DS, SS, or enveloped versus non-enveloped. So we'll talk about the Pox viridae, the Herpes viridae, Hepadna viridae, Adenoviridae, Polyoma, Papilloma, and the Parvo. So remember, guys, for DNA viruses, the only SS are the Parvo. For RNA, the only DS are the Rio. So let's start off with the Pox viridae. So pox viruses produce eruptive skin pustules called pox that leave scars, and the pox virus is actually the largest and most complex animal virus. It has the largest genome. It's known to multiply in the cytoplasm in these factory areas. Variola is the cause of smallpox in humans, which has been eradicated. And vaccinia is a closely related strain that is used in vaccines. There's also very closely related viruses, monkeypox and cowpox, that can be infective to humans. So this is the cartoon image of this large virus, an electron micrograph on the lower right. For smallpox, this was the first disease to be eliminated by vaccination. And exposure occurs through inhalation or skin contact. Infection is associated with fever, malaise, prostration, and this rash, the characteristic pox. There's a difference between the major and the minor version of variola. So variola major is more highly virulent, associated with toxemia, shock, and intravascular coagulation, whereas minor is less virulent. Routine vaccination ended in the U.S. in 1972, and the vaccine was indeed reintroduced in 2002 for military and medical personnel, and usually after they receive the vaccine, some have this nasty side effect that's referred to as the Jennerian vesicle. So this is kind of an allergic reaction to that vaccine. Also, another pox virus is the molluscum contagiosum. So this is in the U.S. most commonly a sexually transmitted disease, and it causes the formation of these small lesions. So they're small, smooth macules in the genital area and thighs, and they're treated similar to how HPV is treated in the case of the strains that cause genital warts, so usually freezing, cauterization, or chemical agents. And AIDS patients suffer from an atypical form, which will attack the skin of the face and form tumor-like growths. Now, other pox viruses worthy to mention here are the cow, rabbit, mouse, and elephant pox. Monkey and cowpox can be infective to humans, but it's usually less severe than the smallpox, variola minor, or major. Onto the herpes viridae. So these are common, persistent human viruses. So all members of this group show latency and cause recurrent infection. The viral DNA forms an episome, and some of these infections can cause serious long-term, even metastasis or carcinoma in the case of AIDS patients. So the Kaposi sarcoma, for example. And these guys will replicate within the nucleus. So here's a cartoon image on the left and an electron micrograph on the right. Now there's 8 different ones that I'm going to mention here, HSV 1 and 2. So these are the herpes simplex viruses 1 and 2. VZV, which stands for varicella zoster virus. CMV, which stands for cytomegalovirus. EBV, Epstein-Barr. And then HHV 6, 7, and 8. So this is roseola, and then HHV 7 and 8. So for HSV 1 and 2, HSV 1, or herpes simplex virus 1, is the causative agent of cold sores. And as far as when this is contracted, typically it occurs in early childhood. For HSV 2, this is the causative agent of genital herpes, and this will form lesions on the genitalia, possibly the oral cavity as well. And this is contracted later in life during the ages of 14 and older, and this can be spread without visible lesions. Now, the key here to remember with the herpes simplex viruses is that, again, they're associated with these dormant pathology cycles, and the reason being behind this is the fact that they will multiply in sensory neurons. So HSV1 will enter the 5th cranial nerve. So it lies dormant in that nerve. HSV2 enters the lumbosacral spinal nerve. And recurrent infection or recurrent outbreak is triggered by various stimuli such as fever, UV radiation, stress, and mechanical injury. And the newly formed viruses migrate to the body surface after this trigger has occurred, producing a local skin or membrane lesion. So this is the trigeminal nerve. This would be where the virus hides out in the case of HSV1 or oral herpes. Now, there's also other clinical manifestations of this. So herpes labialis, this is the most common, but also herpetic gingivostomatitis. So this will cause an infection of the throat, also fever, sore throat, swollen lymph nodes, and then even herpes infections of the eyes, so herpetic keratitis, and this causes similar symptoms as pink eye or conjunctivitis. So going back to herpes labialis, so this is the most common recurrent HSV1 infection. Vesicles form on the mucocutaneous junction of the lips or adjacent skin, and this is followed by itching and tingling prior to vesicle formation. The lesion will crust over in 2 to 3 days and heal. Now, in the case of HSV2, so this is the causative agent of genital herpes, this starts with malaise, anorexia, fever, bilateral swelling and tenderness. And this is then followed by the formation of the vesicles on the genitalia, perineum, buttocks, also urethritis, painful urination, cervicitis, itching. The vesicles will ulcerate, heal, and then followed by future concurrent outbreaks, similar to HSV-1. These recurrent bouts usually are less severe, and the triggers have been found to be menstruation, stress, and concurrent bacterial infection. Now, this can be spread to the neonate and the fetus, and it's potentially fatal. So usually pregnant women are screened, and if they are experiencing an outbreak at the time of delivery, a C-section will be performed. Also, some other manifestations, herpetic whitlow. So this is HSV-1 or 2 that penetrates through a break in the skin and causes a localized infection. This is usually on one finger. It's extremely painful and itchy. Or a rare case of encephalitis. So this is the most common sporadic form of viral encephalitis in the U.S. And those who are more immunodeficient or immunocompromised are prone to severe disseminated herpes, so cases where it could spread to other areas of the body. As far as how we diagnose it, PCR would be the test of choice. So this is the polymerase chain reaction, looking for a specific sequence in the HSV genome. Also, looking for cytopathic effects or fluorescent antibody, cytology, and also serological testing. And there's no cure for this. There are some antiviral meds, topical medications that can inhibit the viral replication cycle, but there's no vaccine or cure. So moving on to VZV, or varicella zoster virus. This is the causative agent of chickenpox and shingles. Humans are the only natural host for this virus. It is transmitted via respiratory droplets and direct contact, and it will manifest itself initially as chickenpox and then later reactivated as shingles. So similar to the HSV-1 and 2, the virus will enter neurons and remain latent, and then reactivation results in shingles with vesicles localized to distinctive areas. This is more common in older patients in the case of shingles, and now we have a vaccine for this disease. So this is just a picture showing you here early manifestation as chickenpox and then later reactivation as shingles. It's a very painful infectious disease associated with a rash on the trunk. And this rash is reflective of the viruses migrating down the sensory nerve to the skin. On to CMV, so cytomegalovirus virus produces giant cells with nuclear and cytoplasmic inclusions, and it's transmitted in saliva, respiratory mucus, breast milk, urine, semen, and cervical secretions. And it is commonly latent in various tissues, mostly asymptomatic. But there are 3 groups that will develop a more virulent form of the disease: fetuses, newborns, and immunodeficient individuals. And this can affect the brain, eye, lungs, and stomach and intestines. So in newborns, they may exhibit enlarged liver and spleen, jaundice, capillary bleeding, microcephaly, and ocular inflammation, and this may be fatal. Usually babies who survive this will develop neurological sequelae or long-term effects, and also hearing, visual disturbances, and mental retardation. If it's a perinatal CMV infection, mostly asymptomatic, or a lung infection and a mono-like syndrome. In AIDS patients, mononucleosis or disseminated, more systemic CMV infection, and also transplant patients seem to develop effects of this pathogen. There is a treatment that's reserved for those who are severely immunocompromised. On to EBV, so this stands for Epstein-Barr virus. This is a very curious virus because of the fact that by midlife, almost everyone is infected. And there are many different strains of this virus. Some will cause infectious mononucleosis, which is characterized by a sore throat, fever, swollen lymph nodes, and these symptoms usually show up after a 30 to 50 day incubation period. And this virus will lie dormant in B cells, later reactivated, and may be asymptomatic. So a lot of people actually do not show symptoms, and it is ubiquitous. It's everywhere. Almost everyone is infected with it. It is transmitted through direct contact, oral contact, and contamination with saliva, so infectious mono, also a common name known as kissing disease, so people in college are more predisposed or susceptible to this. Now, there are cases where EBV infection can lead to cancer. So EBV is considered a persistent viral infection, and this is associated with a specific type of cancer called Burkitt's lymphoma, usually in African American young children who also are co-infected with malaria. We also see cases of this being an oncogenic virus in Chinese and African older men, causing nasopharyngeal carcinoma. Also, anyone who is severely immunocompromised is more susceptible to EBV infection. And similar to herpes, PCR is a decent way of screening for this. Also, serological tests and cytopathic effects, so looking for signs in the blood. And treatment is directed at relief of symptoms of fever and sore throat, and disseminated or systemic disease cases may be treated with IV gamma globulin, interferon, monoclonal antibodies, or an antiviral drug. Now, the other ones that I have left out so far, so the HHV 6, 7, and 8. HHV 6 is the human T lymphotropic virus, and this causes roseola. So roseola is an acute febrile disease in babies 2 to 12 months of age, and it begins with a fever followed by a rash, usually self-limited, and adults may get mono-like symptoms. HHV 6 is interesting for this reason that over 70% of multiple sclerosis patients show signs of infection. So we're seeing a lot of pathogens being associated with these rather anomalous diseases that we don't really know what the actual trigger is. So this is one link. We also see in the case of MS, there's clostridial food poisoning that also is associated with this. And it can cause encephalitis, cancer, Hodgkin's lymphoma, oral carcinoma, and also some leukemias. Now, as far as HHV 7, it's closely related to 6, and 8 is the one that causes Kaposi's sarcoma. So this is linked with a common tumor, very similar to melanoma, of late-stage HIV or AIDS patients, and also may be involved in multiple myeloma. Now on to hepatitis. So Hep B is the DNA virus. Hep A and C are RNA viruses. Hepatitis is defined as an inflammatory disease of liver cells that may result from any one of these three infections. And once you're infected with Hep A, B, or C, it will target the liver. B and C will cause long-term persistent infections, and it will interfere with the liver's excretion of bile, causing the accumulation of bilirubin and result in jaundice or yellowing of the skin and eyes. So this is actually a picture on the left of the hepatitis virus. Now, as far as the hepadna viruses, these have never been grown in tissue culture, so all of these Hep A, B, and C are within this family, and like I said, they lead to long-term effects. So this is referred to as tropism for the liver, so it can actually transform the liver into a cirrhotic condition or cause the formation of hard nodules or even cancer. So B and C can do that. We also see other members can cause hepatitis in other animals, so woodchucks, squirrels, and even ducks. And as far as Hep B specifically, so there is a vaccine for this, but for those who are not protected, if they are exposed and high risk here, high incidence among homosexuals and drug addicts because it can spread via the blood. So blood products can transmit infection also as an STD. The virus will multiply in the liver and continuously seed the blood with new viruses and can lead to a chronic tropic effect. So tropism for the liver, increasing the risk of cancer, hepatocellular carcinoma. So these are all the symptoms of it. Low white cell count, arthritis, fever, jaundice is the characteristic symptom, even a rash, pain, tenderness, and enlarged liver. So the virus will enter through a break in the skin, through a needle, or via sexually transmitted. And once the virus reaches the liver, it will multiply and release viruses into the blood. There's an average 7-week incubation period, and most exhibit few symptoms and eventually will develop immunity. Some experience malaise, fever, chills, anorexia, abdominal discomfort, and diarrhea. Also, fever, jaundice, rash, and arthritis, as I just showed you, are common. And a small percentage of people will develop this chronic liver disease, but it does occur. So here's kind of the step-by-step pathology of the changes that occur on the cellular level. So from Hep B, C, alcohol, also toxins will do this. It basically causes liver injury, and it causes the liver to go into this proliferative state. And what can happen here is once the cells become senescent, so the telomeres are shortened, they will arrest and they will start to form these nodules. So this can lead to scarring and the buildup of collagen. And once you have these subtle changes in the nodules from mutations that occur genetically, then this can transform into this immortal cell, so hepatocellular carcinoma. And this doesn't happen overnight. This requires a few different hits to the DNA, but once this happens, then you have the enzyme telomerase that's reactivated so these cells can continue to divide. Now, as far as diagnosing and managing Hep B, it's based on risk factors, serological tests, screening of the blood prior to blood transfusion, semen for sperm banks, organs for transplant. All of these are routine now. And there were many cases of people being infected with some of these blood-borne diseases like HIV and hepatitis before we were aware of how they were spread. Mild cases of this can be managed by treating the symptoms and supportive care. Also, people can be treated with interferon, and again, there is a vaccine that's derived from a surface antigen from yeast, so this requires boosters, and then one that is derived from a purified antigen for people who have allergies to yeast. On to the adenoviruses. So there's 30 types associated with disease. They will infect the lymphoid tissue, respiratory and intestinal epithelial and conjunctiva. They are oncogenic in animals but not in humans, and they're spread via respiratory and ocular secretion. So these cause colds, sore throats, conjunctivitis, keratoconjunctivitis, and even urinary tract infections. Severe cases can be treated with interferon, and there is a vaccine available. And then on to the papilloma and polyoma. So both of these cause persistent infections and tumors. So these are considered oncogenic. And so for HPV, a papilloma is a benign squamous epithelial growth, wart, or verruca. There's over 100 different strains of HPV, and they all cause different types of manifestation. So not all of these 100 will cause genital warts. Some cause these common seed warts, which can be found on the fingers or on the feet, plantar's warts. Genital warts there are a few of these strains that can cause this infectious disease. It's the most common STD. And as far as the warts that form, they range from these tiny, flat, inconspicuous bumps to extensive branching cauliflower-like masses. And if any of you have heard of the tree man, so there are people who are infected with some of these strains that end up forming these hard wart-like growths on the surface of their skin. And I believe this guy, he's been on the Discovery Channel a few times. He has undergone multiple surgeries to get these removed. And we also see there's genetic predispositions to contracting these viruses and developing these growths as well. So transmission is through direct contact or contaminated fomites, and the incubation is anywhere from 2 weeks to more than a year. Now, I said that these viruses were oncogenic, so there's 9 HPV types that are known to be oncogenic. So they seem to increase the risk for developing reproductive cancer. 2 of them account for 70%. This number has actually gone up since, of metastatic tumors. And the cases of cervical cancer or reproductive cancer have actually gone down through preventative measures. So through that early detection, through inspection of genitals and the Pap smear to screen for abnormal cervical cells. Most common warts will regress over time. They can be removed by direct chemical application and also physical removal by cauterization, freezing, or laser surgery, but they can come back. And Gardasil has been released previously, so this was in 2007, so there is a vaccine that is available. Now, as far as the pathology here, so I showed you guys the pathology for hepatitis and liver cancer. So in the case where a female is exposed to some of these high-risk strains, the HPV virus will infect the basal cells and it will start to undergo viral replication. And so you have the formation of this episome or this viral genetic information within these epithelial cells. And in 90% of these cases, individuals heal within 2 years. But there are some cases where we see after this initial infective stage, anywhere from 10 to 30 years, when the HPV DNA gets integrated into a mutated cell, what happens here is that if you have the perfect recipe for disaster, this cell will develop into a cancerous one. And so it all has to do with, remember, going back to what I said about those oncogenes and the tumor suppressor genes, so they drive the formation of cancer. Now, the polyoma viruses are seen to induce tumors in experimental animals. The JC and BK viruses are the most important human polyoma viruses common throughout the world. And majority of infections are asymptomatic or mild. There's actually not a lot known about them. BK infection associated with renal transplant seems to cause complications in urinary function, and there is this very uncommon fatal infection by JC called PML, which is progressive multifocal leukoencephalopathy. Very rare. Actually, there's a picture down here of the polyoma just showing you these are the proteins that are used for attachment, and here it is on the right under the electron microscope. And then lastly, we have the parvoviruses. So again, these are for DNA, the 1SS DNA viruses. They're small and they're associated with distemper in cats, enteric disease in dogs, and a fatal cardiac infection in puppies. Also causative agent of Fist disease in children. So you may see a fever and a rash on the cheeks, and also severe fatal anemia can result if pregnant women transmit this virus to the fetus. And also, curiously, AAV, so this is adeno-associated virus, cannot replicate without the adeno, and it's very similar to the one that causes B19 that's associated with Fist disease. So that wraps up the DNA viruses. I will see you guys for the RNA viruses.